Welcome to the girls, and today we're going to find out the skinny on being skinny.
All right, a magic pill, a magic shot, something that makes you skinny?
Well, that's what everybody wants, right?
It's the latest phase? Fad?
Fad phase. Well, dieting's always in, so
Yeah,
it's not
that's
even
true.
a fad. Everybody wants to be skinny,
Well,
but
that's
they
true.
want the instant skinny.
Okay,
So,
sign me up for that.
Sign me up for that. Well, there are so many things on the market right now. It's been a hot topic, and one of the things I know is almost once a week someone will ask me about Wegovy, Ozempic, because we're flooded with the commercials on TV for all of these medications. And today we have an expert with us because Dr. Benyo, who is our resident SSP TV doctor. He's a member of the LVHN group here in Hazleton, and he has a show, It's Your Health. Talks all about every topic you can imagine. But today we're going to talk about one thing in particular, all of the medications and everything that's out there. So Doc, welcome to the show.
It's a pleasure to be here on the girls.
Is this your first?
It is my first,
It's his
yes.
first.
Aww.
And a privilege and pleasure to help elevate your ratings.
Thank
Let's
you.
put it that, just like
That's why we have
Right there, elevating those ratings.
But we're going to give you medical information today. However, check with your healthcare provider before doing any of the things that we talk about here on the girls.
That's right. That's right. We're going to give you a lot of information so that you again can choose for yourself what is the best choice for you. Later in the show, we did ask our following on Facebook a question about, I call them the shots, the diet shot. And so we'll get to those questions and comments later in the show. But it's very interesting to see that people feel strongly either for or against the medications.
Right.
Right?
Well,
We're
let's just
talking,
start off there.
GLP-1s. So let's start at the beginning, and I'm going to take you back a couple of weeks ago. I'm hungry, and so I get a 12-inch hoagie, cut it in half, and say, well, this is going to be my lunch. So I start eating the hoagie, and about halfway through, my body releases glucagon. Glucagon comes from our pancreas, normally. And what it does is it distends the stomach, and it tells my brain, you're no longer hungry. And sure enough, after the half a hoagie was gone, I said, you know what, I'm full. I don't want to eat anymore. I'm going to save the rest for a rainy day. 6 to 8 hours later, my glucagon levels are no longer existing, and I'm hungry again. So I finish the rest of the hoagie, and the same thing happens. So GLP-1s are glucagon-like proteins or peptides. They're virtually the same molecule gets released after you eat. Now, the glucagon that we make doesn't last more than a couple of hours. It's gone, which is why I was hungry again 6 to 8 hours later.
Do you get glucagon from eating?
Yes.
Okay.
My pancreas, your pancreas
Okay.
secretes it.
Got it.
That's in a normal person.
That's in a normal
If their
person.
pancreas is functioning properly.
Correct.
Okay.
So that the GLP-1s are glucagon-like proteins that are injected. There's one that's oral, but the beauty of the injection is the glucagon does not get degraded. It lasts a whole week. So you walk past a Stromboli and you say, not today. And that recurs and recurs and recurs. So you don't want to eat. And if you do decide to eat a lot, guess what? You may end up getting nausea, vomiting, bloating. So you're kind of negatively reinforced for eating as opposed to getting positively reinforced.
Well, can you eat at all?
Sure. You start on the lowest dose possible. Usually it's 5 doses. You go low and you go slow. The other added effect is you generally don't want to drink alcohol. So some people who like to imbibe, if you will, no longer. And keep in mind that alcohol has more calories than candy. So people will incur weight loss by cutting down on their alcohol use. And so it's a tremendous drug for diabetes and for weight loss. And there are some drugs that are out there that will be available, the GLP-1s for weight loss. Some of the GLP-1s are weight loss and diabetes. And as I mentioned earlier, there's only one that's an oral one. You have to take that every day, whereas the injections are once a week.
So, as I mentioned before, the names that are thrown out there on these commercials, Wegovy, Ozempic, are they all the same, but they're just different
Pretty much the
brand
same.
names?
There's a list that we'll show you. And they're virtually all the same, except Mounjaro has a GLP-1 and another chemical that gets secreted after you eat, which kind of magnifies the GLP-1. And so that when you see studies, it's the Mounjaro that usually has the most weight loss. Now, getting back to what they were originally prescribed for was diabetes. Keep in mind that 70% of our US population is overweight. And on that train of being overweight comes diabetes, hypertension, sleep apnea, heart attacks, strokes, so that these medications lower all of those risks, so that the weight loss that magnifies these other illnesses tends to go away. And I think that's the beauty of these medications. On this next slide, you'll see the benefits of these GLP-1s. Cardioprotection, loss of the blood pressure issues, lowering of blood sugar, lowering cholesterol. The arteries are more relaxed, you're more relaxed, and they've had tremendous, tremendous results in lowering cardiovascular and cerebrovascular stroke things that have been associated with obesity, diabetes, and that whole trainload of things. It's unbelievable. It truly is unbelievable.
So, doctor, if someone is considering doing this for just weight loss, how do they start this? They see a doctor first.
Right.
And they're evaluated.
There are certain people that shouldn't be on these medications. For example, if you have certain degrees of renal failure already, if you have a history of thyroid cancer, particularly medullary thyroid cancer, if you had it or it runs in your family, if you already have inflammatory bowel disease and bowel issues to begin with, you probably shouldn't be on these medications. So we would make sure that you are a candidate, make sure that you don't have another issue like a thyroid disorder that could be complicating things. And then, as we mentioned, we can prescribe these medicines, usually the lowest dose first. Now, the kicker is the insurance going to pay for it? They advertise this stuff, but they're kind of stingy on reimbursements, and that's probably the biggest hurdle.
So
that's
who is
where-
the prime candidate? Like
That's
what?
where it gets tricky with people using online. You see ads for it where you don't have to go through a doctor. They say call this number and we'll get you approved. You see the compounding. Okay, so are these online places and compounding isn't FDA approved.
Correct.
And I don't even know if if you're able to get it from the articles I just read. They were going to take that off the market.
It is in a state of flux.
Okay.
And so if we get back to the people who successfully take these medications, the weight loss generally is tremendous. And you step up the dose. After a couple of months, you might go to the next highest dose and wait for a couple of months till things level off. And if you go low and go slow, we generally avoid the side effects of nausea, vomiting, abdominal bloating, things along those lines. And if they work without side effects and they reverse the things that have been going on in your life with weight gain, hypertension, diabetes, cholesterol, sleep apnea, they're really a godsend, really a godsend.
So you've seen great success. You've had patients on it before?
Yes, and I can't say I'm a big proponent, but I like what I'm seeing. Here's the kicker. We don't know the long-term side effects. We don't know what happens when you stop it.
Yeah.
So, you may end up gaining the weight plus. And again, the medication works through your stomach and tells your brain you're no longer hungry. Now, if that were to continue off the medication, that kind of falls into the category of, it's mind over matter.
Right. While a person is taking the medication, do they follow a diet and exercise as well, or is it just take the shot?
They could. You take the shot. Most people who start getting weight loss, they get hooked on this and they say, wow, this is amazing. I only lost 5 pounds this month. I want to go for 10. So they'll kind of gin up the exercise because maybe they feel better. They're a little lighter on their feet and they're getting positively reinforced by the use of the medication. Some people it doesn't work at all. They say after 3 months I haven't lost an ounce.
Really? Wow.
I've had friends who either lost a significant amount of weight and had no side effects to people who've gone on it and haven't lost a pound or have gotten sick.
Right.
So
it's...
is that something to do with just how you're made?
I think it has to be with your metabolism. You know, this whole obesity stuff is difficult to unwind. Some of it's genetic. Some of it is mind over matter, if we mentioned earlier. And it's lack of activity, for example. We're a very sedentary society now. So, you know, throw in COVID and we all become sort of hermits and we don't want to go out and do much anymore.
All right. Well, we've asked our Facebook family, right, some questions that they had. So when we come back, we'll talk about that, hit on some other points of the pros and cons, right, of the shot.
Sure. I'm sure we have a lot of pros and cons. Stay with us. We'll be right back. Welcome back to the girls. I'm sure you have a lot of questions and we're hoping to get all of those answered for you. But as we mentioned before in the beginning of the show, if you're interested in doing anything with weight loss, make sure that you see your doctor, find out what's right for you. We're not promoting anything here. So we have Dr. Benyo with us and we're talking about GLP-1, which is the fantastic weight loss drugs that are now available. And what we didn't get into was, okay, they're a miracle, you lose weight and whatever, but what are some of the natural ways maybe you could do this?
Sure. There are natural foods that will increase your GLP-1. Generally, they're plant-based, such as nuts, avocado, the whites of eggs can do this, peanuts, pistachios. What they do is they hang around a little bit longer in our body, if you will, and that kind of tells the pancreas, let's get more of this glucagon that you're making in your bloodstream, and then it can suppress your appetite in that regard. So there are natural ways of doing it. A lot of it's just portion control, quite honestly. I didn't eat the whole hoagie. I only ate half because my glucagon told me you only need a half.
That's because your glucagon's working.
But if you have, I think if everyone, I mean, most people would know what to do. It's like most people don't do it. So it's harder than it sounds.
Right. Yeah.
So would it be that obesity is tied to a mental condition as well, and it is a
How about
a disease.
emotional?
It's a disease, right?
Listen.
So is that
Food is love.
yeah?
How do
yeah.
you say no to Lushki's? I mean, you can't, right?
Or Jimmy's hot dogs? You know what I'm saying?
Exactly,
Or Sam's
exactly.
Pizza.
Which gets into the side effects of some of these medicines. Let's face it, for every reward, there's a penalty. You can get allergic reactions to the drug itself, or you're injecting yourself. If you not know what you're doing, you can get an allergic reaction or a cellulitis.
Oh,
at
wait,
the
so
site
you
of
don't go to the
injection.
doctor to have this injection, you do it yourself?
Do it
Yes.
yourself once a
Ooh.
week. Once a week, you just pinch your belly and give yourself a shot. Of course, there's if you're diabetic, you could have low blood sugars because this does affect blood sugars if you're on other diabetic medications. Generally would not do that if you're a non-diabetic. We've seen what's called Ozempic face, where you actually lose the fat in your face and you now have lines that weren't there before, or it's sort of sagging, if you will. You can have kidney disease, although it's supposed to help kidneys. It can sometimes cause havoc with your kidneys. Pancreatitis, life-threatening, an inflammation of your pancreas, because I mentioned earlier glucagon is made in the pancreas, and here's you're kind of stepping in their door, and they may not like it. Hair loss, because the protein and the weight that you lose may not be all fat. You may end up losing protein, which would be your hair. And who knows what's going on with your muscles? You might lose some brain for all we know, or some heart stuff. This weight loss may not be just to fat in and of itself. You may lose some protein that you should be holding on to. a little scary. And of course, if you have excessive weight loss in a very short period of time, you can precipitate gallstones. So you can get acute gallbladder attack. In fact, if you recall when people were doing stomach surgeries, they took your gallbladder out prophylactically, if you will, because we knew you were going to get stones. But interesting studies showed that the GLP-1s actually cause more weight loss than stomach surgery.
What? That's crazy.
Yeah, it is
That's
crazy.
amazing.
So talk about the difference between, did you have something else?
I did want to ask while we're on that subject. So you're giving yourself a shot every week?
Yes.
Okay, every week. When do they come back to see you? Because how do they know if they're doing along with this weight loss correctly? Like, how do you monitor this?
Right. We generally give 2 to 3 months of that dose of medication, the go low and go slow, the slowest dose first. And then people will report side effects, if you will, and they should obviously do their due diligence with this medication, what to watch out for. I had one patient who I said, listen, you got to eat small meals. Don't eat after 6 o'clock. So he had a pepperoni pizza at 9 o'clock. Whatever he ate stayed in his stomach till the morning, and he vomited everything up.
Oh.
Because these medications sort of paralyze the stomach. So everything he ate stayed there and came out. So you're not going to want to do something like that. You're kind of reinforced to behave. But that was another side effect that we didn't really touch base about, is gastroparesis. The stomach may remain paralyzed on these medications and never regain its motility.
So the difference between the medications through the doctor's office that are usually covered with insurance, if you go the other way where I'm not covered with insurance, I've seen ads, and Mom's seen ads on Facebook, on Instagram, where they're saying call and we can get you this drug. You don't have to go to your doctor. Also, you can get them through compounding. So what's the difference with the compounding?
Right. Well, when I order amoxicillin, it comes in a capsule. I go to a regular pharmacy and they count it out and it's there. In the olden days, if you ordered amoxicillin, they had a mortar and a pistol. And they were making it and crushing it, and that's sort of what compounding is. Okay. So compounding may not be the entire drug. There may be something else in there as a filler. I'm not sure they really are obligated through the FDA to announce their side effects or their ingredients. So I'm a little, compounding is sort of a sidebar issue, and it's available.
Yeah.
Are they legal?
Well, it's not FDA approved. I don't know if is it legal right now?
It is legal. It is legal to compound any medication. Okay. But again, you have to go to anybody who's reliable, and if they're a reliable compounder, then I don't think you'll have an issue. The internet, of course, has its ghosts. You have to be very careful about that.
It's just scary to me to think that someone would go and do something without seeing their doctor. That's because I guess I'm a nurse, number one. Number two, I'm very hesitant on anything. And I always look for natural ways to do things.
Absolutely.
And things that'll help your body. That's a quick fix. We don't
I think
know
when
what
you're
the
desperate, though, I
long-
don't think you're thinking like someone who maybe be really heavy or has been heavy their whole life and they're desperate to lose weight.
Right, but
So
go
you
to a
can-
doctor.
I know what you're saying, but I think sometimes you would want to try anything to lose weight. What happens when you stop the shots, or can you stay on them forever? Questions from our...
Right. We don't know the long-term effects or side effects. As I mentioned, once you're at goal, you might want to wean down to a maintenance dose. And then some people who were on the medication, their insurance changed and they had to stop it, they gained it plus.
Michelle Gresh, she's been on our show. She is a personal trainer, and she would like to know how we are supposed to train individuals whose appetites are curbed so much that they are basically in starvation mode and do not have the adequate fuel to exercise, even if they wanted to. She is seeing a lot of this, people struggling to make it through basic exercises because they've lost so much muscle.
Well, there were a couple of instances where patients became addicts, if you will, to the medication and wanted to become almost cachexic and too thin.
Yeah.
Which is not good. That's another maybe mental disorder. I'm not sure.
Okay. I know some people who develop gastroparesis and stop taking them but still are sick when eating. These are people who were prescribed it for diabetes.
Right.
So-
Well, diabetics in and of themselves independently can get gastroparesis.
Okay.
That's sort of what's called a neuropathy or nerve damage that the diabetes itself can do. So the medication heaped on that may only magnify it.
Amy Cartwright, a dietitian, GLP-1 medications are not just weight loss shots. They're FDA-approved medicines used to treat the chronic disease obesity and help with weight management as part of a comprehensive treatment plan that also includes diet and exercise. These medications work by mimicking a hormone in the body that helps control blood sugar and appetite, which we've talked about. It's more about treating obesity as a medical condition rather than just a weight loss shot. How much research has been done about the long-term effects, which we talked about? So from Amy's point, from what I'm hearing, is more treating it like obesity as a medical condition. I guess those were the words I was looking for before.
Right,
A medical
and
condition.
in some people, as Doc said, it is. There are people who've tried diet, exercise, Jenny Craig, Weight Watchers, like they've gone through the whole thing, having the food sent to them. Their bodies, for some reason, just don't want to cooperate.
Would you say it's more for people who are morbidly obese than people who need to lose like 15, 20 pounds? Or
Well,
can the shot be used for them too?
It could be used for them,
Okay.
and to some extent, some people say, just get me the 20 pounds and then I'm on my own. I just need a starter, if
Yes.
you will. Keep in mind the medicine was originally designed for diabetes.
Okay.
And as a rule, people who are diabetic are generally overweight.
Doc, if they take this medication and start controlling their weight, do they reverse diabetes?
Yes. Yeah, I've had people who had hemoglobin A1Cs, which is the marker of diabetes. They were uncontrolled, and having lost 40 pounds, they've normalized it off medications.
So that's the big goal for people like
The big goal is to lose the weight and take the risk factors for heart disease, renal disease, sleep apnea with you.
And we have about 1 minute left, so when we continue this series that we're doing on the drugs, the GLP-1 drugs, we'll have some people on talking about their success stories. And then we also know of some people who have not had any success with it, which we have their comments, but they didn't want to come on the show.
Right. It's a great topic. I think you've cleared up a lot of the fallacies out there and a lot of questions that people have had maybe who are thinking of doing it and not knowing what to do. So hopefully if you have any other questions,
right?
yes, but if you have any other questions, you must see your healthcare professional. We're not promoting it, we're not telling you it's good, it's bad, we're just providing information through a professional doctor. But with anything you see on TV or you see on Facebook, don't try it. Call your doctor. Don't you think, Doc? I mean, there's so many things.
Go through your doctor first.
It was a pleasure coming here, and I'm hungry.
You're hungry.
I have half a hoagie for you.
Oh, I have an egg white for you.
There you go. I have an avocado for you too.
Very good.
That'll work on your GLP.
Oh, gosh. All right, well, we'll see you next time on The Girls.